see. Okay, we're all set.
Thank you. And with that, we call to order the meeting of the regular meeting of the Strategy Committee of Access Health Connecticut. And I welcome everybody. And I wonder if we might have a roll call or at least a roll call and then introduction of all the participants, if we would.
Hi, good afternoon, everyone. This meeting is being recorded for minute-taking purposes, as well as posting the recording of the proceedings on the agency's website. This meeting is also live streamed on the AHCT website. And roll call attendance, Steve Hernandez.
I'm here, present.
Grant Ritter. Paul Philpott. Paul Lombardo.
Here.
Matthew Broekman. And Sean King.
Here.
Thank you.
Great, thank you. And can the members of the Access Health team also introduce themselves?
Absolutely. James Michelle, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Holly Zwick, Director of Finance, Access Health Connecticut.
Hello, Susan Rich-By, Director of Legal and Governmental Affairs, Access Health Connecticut.
Tom Carbone, Director of Small Group Product Development and Brooklyn.
Good afternoon, Glenn Jurgen, Director of Human Resources with Access Health Connecticut.
Good afternoon, Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
That's great. I think that's everyone.
Yes, that's us.
Great.
That's all of us. Yeah.
Wonderful. Well, welcome to everybody. And I just wanted to take this opportunity to again thank you for that amazing convening that you held on in support of small businesses. It's always such an inspiring coming together, really, of resource and opportunity, but also just the excitement of how it is that we work with community and we work with small businesses to live out the American dream. So thanks so much for what you do there.
Absolutely. It's one of our signature events every year. This was our second one, and it continues to get bigger and better every year. And I want, on behalf of the organization, I would like to thank you, Steve, for being our MC for the last 2 years. Thank you very much. Very successful. It gets bigger and bigger every year. John could give a quick recap on that event. Doing this as well as doing the board meeting next week.
That's great. If we could move to adoption of the meeting minutes. These are the minutes of the January 11th, 2024 Strategy Committee meeting. Could we entertain a motion, please?
So moved. This is Sean.
Thank you. And a second?
Paul Lombardo seconds.
Thank you. And could we have a roll call vote, please?
Thank you, Mr. Chair. Steve Hernandez.
Yes.
Grant Ritter. Paul Philpott. Paul Lombardo.
Yes.
Matthew Broekman. And Sean King.
Yes.
Thank you. Motion passes.
Thank you so much. And I know now, James, that we have a new initiatives reports that you and your colleagues will be reporting on. So maybe we can move to that.
Absolutely, and thank you very much. So we have several new initiatives, strategic initiatives that we are working on. The first one is 10 clicks. I'm going to ask Gina Walsh, our Director of Operations, to give an update on where we are and what the next steps are. Gina.
Thank you. Good afternoon, everyone. I'm Gina Walsh, Director of Operations. I'll be giving the update for the 10 Clicks or Less initiative. So at the January Strategy Committee meeting, I shared the objectives of this project, which are to decrease health disparities, reduce the rate of uninsured Connecticut residents, and enhance the consumer experience with our enrollment system. So this project aims to redefine the overall experience around enrollment and eligibility, exploring all the connections and all the people, including our certified application counselors, our brokers, our navigators, in the overall experience to make it a much smoother process. We continue to move this initiative forward. we did the company, along with some of our outside partners, did some brainstorming sessions that concluded in April. And then right now, currently, our 10 clicks or less steering committee is actively evaluating a user experience blueprint model that Minton Hoke, our strategy vendor, developed from these work sessions. So very excited to have received that and to start digging into it. We have also met with 7 of the other state exchanges to view their enrollment and eligibility systems to gain insight into different application flows that work for them and their consumers. Some of these exchanges have undergone system transitions in the past few years, and some of them are brand new. So we've learned a lot from all the different states and continue to do that as we progress forward. So our next steps are to look at that blueprint, that strategy. And once we get into that, we will start to decide which path we want to do to move forward. And as we do that, I'll update this committee the next time we meet, where we are and what our next steps are. So thank you. Any questions?
So I just want to put a little bit of, again, this project is to look at our current system, determine what we have to do to make it easier and faster for applicants, as well as those who are reapplying to get access to health insurance, because we are still using the same technology that we deployed back in 2012, 2013. So this is going to help us move forward, make it easier, therefore should move us closer to achieving our ultimate goal of lowering the uninsured in Connecticut and helping to address health disparities by giving Connecticut residents who are eligible to purchase insurance or get access to Medicaid as easy as possible. Mr. Chairman, the next item, if there aren't any questions, we can move on to the next item on the next project that we are focused on, if you will. ICRA, and John is going to give you an update on that. John?
Good afternoon, everybody. John Carbone, Director of Small Group Product Development and Broker Support. Hope everybody's doing well. As you guys have known, probably over the past 6 to 8 months, we've been working on the initiative of individual coverage health reimbursement arrangements. We've been going out, submitted out an RFP early May, and we've gone through the evaluation and scoring of those vendors that have submitted in a request to potentially provide us with a platform. Just to give you guys a little background on why we're taking this initiative and kind of try to take a very complicated product, simplify it into a couple of sentences. This is a product that we're looking to try to help our employer groups here in Connecticut find an alternative option to help them with health insurance and be able to put individual members into different categories and classes to allow individuals that were not able to get a subsidy potentially be able to get a subsidy on the individual market, but still have that employer group feel into the marketplace. This has been a product, as you guys have known, been around since 2019, has just started picking up traction over the past 6 to 7 months across the United States. Currently, right now, there is no exchange taking on this initiative. We are, and we feel it's something that's going to be a tool in the toolbox. So by us submitting out the RFP, we basically have received a number of vendors that have come in. We have an internal team that has gone through the evaluation process of scoring all the requirements and making sure we do our due diligence on the front part of all the requirements on our technical requirements, to our platforms, to our CMS requirements, and to what Access Health is looking to do to deliver out to the Connecticut residents. We are now in phase 2 of that RFP, which is the evaluation part for presentations. We have completed our last presentation as of yesterday. So our team is going to be meeting on Monday to basically finalize those scoring, do our due diligence on making sure we reach out to every single reference that's out there that has been given us to validate what can be done, what can't be done with the platform, and making sure that we make the right choice going forward. So we're hoping over the next 2 to 4 weeks to kind of have an opportunity to make a recommendation a lot earlier to the Access Health team and James to basically move forward and hopefully have a contract in place with a vendor if we find it to be appropriate and necessary that we do have the right vendor in place. So we're really excited. We've got a lot of work ahead of us and we're looking forward to it. So please, we'll be in touch. And Steve, I just want to reiterate, James, thank you very much for your help on MC. And I'm going to take the opportunity to extend it out for the next year. If you're willing to accept, we truly appreciate that. We definitely do want you.
So, hey, John, very quickly, can you give a timeline for the ICRA to go live? And also, can you give a little bit more, elaborate a little bit more about the Small Business Summit in terms of attendance and the structure of it? All right. Thank you.
Yeah. No problem. So for the ICRA platform, we're looking to do a soft launch around 10/1. There are a lot of things that come in play in that. Can the vendor roll out the product? Can we meet all the requirements? Can we get our carriers to participate in that launch? And why we feel a soft launch on 10/1 is that we like to make sure we are going to do this right and do this one time. And we're going to deliver it to a kind of a unique SIC code, which is basically kind of I'll give you an example, a non-for-profits. We're going to focus in on an area like that with a number of brokers to make sure that we have the workflows and the delivery systems correct from start to end, and we're able to work with our current platform. So with that being said, we're looking to kind of do a soft launch 10/1 for 1/1, and then a full blown out launch in very early Q1 25. Is that anybody have any questions on that? Excellent. Thank you. Connecticut Small Business Summit, as you guys, some of you did participate in it. We were really excited. We had 225 vendors total, 225 individuals that participated, a little over 40 vendors that had vendor tables there. In total, we had a little over 345 individuals at the event. We had over 40 different speakers at this event. So we're really excited. We're continuing to grow it. We're continuing to find ways to support it and continue to move forward with it. We're in the process of already kind of going through our lessons learned. We will be reaching out to advisory committees and other board members and trying to get some more information in. We are planning for next year too. And as James has always kind of said to me, we have to make it bigger and better every year and find out a better way to do it and be more efficient with it. So we're really excited for next year.
Thank you, John. Again, just kind of add a little bit to what John said. The purpose of doing the Small Business Summit is to connect small businesses with the resources that they need but don't normally have access to. So by bringing all the vendors, banks, insurance companies, and other small business organizations together under one roof, we are providing them access to those vendors. But we also have a number of breakout sessions where we have professionals, experts in particular areas that they would normally have to pay for. And we have customer service, on insurance, and we have sessions, breakout sessions in the morning and the afternoon. In the morning, particularly, and we have keynote speakers. This past year, keynote speaker was Congressman Joe Courtney, and we also had other speakers as well. Again, giving them access to information and knowledge and people that they normally would not have access to unless they have lobbyists and money to help them get those access. So that's the ultimate goal, is to give them access to information and services that that they need but don't have access to.
So James, I'd like to. Perfect. Thank you. I'd like to add too, we have completed we also developed a website because each individual session that we did do in the events with any of the speakers, we recorded it. We received everybody's permission to release it. We are posting them all up on our Connecticut Small Business Summit website, and I will send everybody out the link. I'll send it to Margot if she can send it out to everybody. We'd appreciate that, and you're welcome just to go on there, watch the videos, take a look at the entire event if you weren't able to attend.
Thank you, John.
Thank you, sir.
That's great. And just a quick question, James. With any of your initiatives, I would imagine that somewhere along the way, you're either informed or you learn of policy initiatives that Access Health may be supporting. to either make easier access or at least bring opportunity, not only to our small businesses, but also to our insured, and then of course to the uninsured. So I'm wondering, or the underinsured. So I'm wondering if that's something that you're always thinking about, and how it is that we may help in delivering some of this messaging to the legislature.
So thank you, Steve. For the ICRA coverage health reimbursement arrangement is a good example of a policy that the IRS issued back in 2019, as John indicated, that we are deploying. We are the first exchange deploying it to make it easier and make insurance more affordable to small businesses and their employees. One good example. The other one is Cover Connecticut. As you know, there's a policy that came out of the state legislature and the governor's office that has been very successful in that. I think right now we have over 30,000 Connecticut residents in that program, and where again they are getting health insurance at no cost, not Medicaid, access to QHP health insurance, where between the federal government and the state of Connecticut, all of the costs in premium as well as cost sharing are being covered between the federal government and the state of Connecticut. So we are meeting. We will be meeting where we have met with the real estate and insurance committee of the state legislature on other issues, but we have talked with them specifically to give an update on all the initiatives that we have going on, and but more importantly, what steps we are taking to do in-person outreach in specifically communities that are hard to reach. So to your point, we are working on that. We have been doing that, but we are working more on that as well. As you know, the board may be aware of, I think in February, we had a open house at the LOB. We were there for half a day, and we invited all the state legislatures and our board members to come in and meet with us, and also share information about what we're doing. So we are doing the outreach we need to do with the state legislature, but we need to do more. But we will be meeting with the real estate and insurance committee specifically around what you just brought up a few minutes ago.
Thank you so much.
Okay, the next item on to report on is on the call center. We have a new. I'm going to let Gina, head of operations, to give an update on where we are at the call center. And this is a major project for us. And we're talking about this is how our customers, many of our, not just access, but also Medicaid applicants, get access to health insurance through the call center if they don't have access to a computer or the internet. Gina.
Thank you. Good afternoon again. Gina Walsh, Director of Operations. So just wanted to give a brief update about our call center and some exciting news that is coming up. So we've been working with the Department of Social Services over the past few months to finalize a request for proposal and all the documents that go with it. The last time we issued an RFP for the call center was in 2016. And we look forward to seeing what other call center vendors have to offer us and our consumers. As James just stated, it's the main point of contact for a lot of our consumers who don't have a computer to come in and apply for coverage and walk through an application with a customer service representative. So our next steps on this is we will issue a request for proposal for the call center services in July. So we're excited to see who responds to it. And again, we will keep this committee updated as we move forward on that. So thank you. Any questions?
Thank you. I will jump in for the Medicaid unwinding update. It's Susan Ridgeby. You go to the next slide, Margot. Thank you. So some of you probably know March of 2024 was the last month of the unwinding for the state of Connecticut. We did it over 12 months and started in 2023. So the end of March were the last potential termination dates of Medicaid coverage for people through the unwinding process. We created an extended special enrollment period for people coming off the unwind. So they have 120 days to enroll in coverage. So the last 120-day special enrollment period began at the end of March and runs through the end of July. And then after that, CMS changed the rules last year. The normal 60 days for a special enrollment period for someone who is losing Medicaid eligibility just in general has been extended from 60 to 90 days. So our system will jump to the allow the 90-day special enrollment periods for people. Some metrics for you to date. During the course of the unwind, 11,516 people enrolled in a qualified health plan, 8,183 enrolled in the Covered Connecticut program, and 2,089,904 re-enrolled into Medicaid Husky Health. So a lot of them were, even though they got terminated and hadn't updated their app when they came back in, they actually were eligible and re-enrolled back in. So if anyone has any questions. And this data is as of the end of last month.
Thank you, Susan.
Thank you.
Mr. Chairman, the final presentation we have is an update on Broker Academy, where we are, how things went thus far, how things are going thus far. Tammy.
Thank you, James. Tammy Hendricks, Director of Health Equity and Outreach. Good afternoon. I'll go through some updates that I have on the Broker Academy. I really can't believe it's year 3 and the program continues to grow. We accepted 80 students initially at the beginning of May, and then we started out with the weekly program readiness meetings, really getting the students prepared for class. We started out with an orientation, getting them adjusted to the Kaplan portal online, showing them where to find their materials and study resources on the site. We actually did a presentation on study skills, and they had the opportunity to speak with a mentor, a past mentor and previous students of the Academy, which was always an interesting call when they get that. Lots of good questions. And it's very helpful feedback for the students and for us, right? We're getting live updates on thoughts about the program, what we could improve, and we take that back and take that into consideration when moving forward in planning for future years. So 5 years of prep for the students leading up to the class day. We had 2 locations. The first was Capitol. This is our 3rd year at Capitol. And the second location was Norwalk Community College, which is a new location for us. And to be expected, we did see a slight decrease in class size leading up to the actual in-person training. So the final numbers for the class in Hartford was 35 and 18 in Norwalk. And last year we saw a similar reduction as well, leading up to the actual class days. But overall, this year we saw a 35% increase in class size. And that growth was close to 75% in the Hartford class, which is always our biggest class. And the other plus is all the students that attended the first day completed the class. They came in every single day, which is always great. We don't want to ever lose students once they actually step foot in the classroom. So this year, we changed up the schedule a little bit. We had training on health insurance in person as usual. All the students passed that class certification exam, which is required to sign up for the state exam. And so we built in an extra day after they took the class test to get a review day in with the instructors and get some last minute questions answered while they had the instructor on site. So by the end of the day, by the end of Thursday, all the students were scheduled for their exam within 3 weeks. Now, some did take the exam on site that Friday, which we dedicated that day for folks to come in if they wanted to take the exam in the actual classroom. Some opted to for more time, and they took the exam at home or at a Pearson VUE location. So as of today, we've had 13 students that have passed the exam. The team is working to get those students matched up with mentors to start their mentorship. And this year, the mentorship is an additional 2 months, which is great. We had a lot of requests from the mentors and from students asking for more time. So we did build in that extra time, and it is really appreciated, especially for the group of students that we're working with, right? They need more time to get adjusted to the material, to get adjusted to the industry in general. So we're really excited that we were able to add those extra months in for the internship. But just a really huge effort from teams throughout the organization. This is a really heavy lift. And I like to call us professional cheerleaders, right? We're really there on site all week, all day, encouraging students, making sure they get across the finish line. And just hearing the students, all the stories, this program is really life-changing for a lot of folks. So thank you to this committee for helping us through year 3. And, you know, when we come back, we'll have more data on the demographics. Of course, this class was no different than the last, the previous 2 classes, majority minority females in our classes. Really good on that end, but we'll have more survey responses and demographics and some other data for you to come. And that wraps up my update. Happy to answer any questions.
Thank you, Tammy.
All right, thank you.
Thank you for those great updates, and thank you to your team. I see that there might be a hand raised. Is that right?
Yeah, Sean King.
Yeah,
Yes.
it's Sean. Tammy, thank you so much for that update and the highlighting the success of the Broker Academy and this year and in past years. This really is a great project, and I love to see that it has been so successful at its infancy stages, and hopefully continues to grow and continue that trajectory. I was just curious about the attrition of students who are accepted and then choose not to participate. Do we track any kind of information about why they kind of opt out of going forward with it? And is there any kind of like a wait list or anything that we build to pull from when those vacancies occur in the class?
Yes, so we don't collect actual data, but from the majority of responses that we've received, it's either can't take off of work, childcare, or transportation. Those are the 3 biggest reasons that we get leading up to class. Now, everything before that is virtual, so it's pretty convenient for most people. But when it comes to the actual in-class training, we do see that drop off because a lot of folks report those three issues. What was your other question again? I'm sorry, Sean.
Do we have a waiting list? Do we create a waiting list?
We do. So we do create a waiting list. It hasn't been a very big list the past 3 years. We do work our way down, but at maximum, I think max, I've seen 10 folks on a waiting list over the past 3 years. So it's really, for this population, it's really important that they get in on time. We give them plenty of notice. So we don't find that a lot of folks can make it if we do have that waiting list and then pull people last minute. It's kind of hard to get folks into the classroom at that time.
And
Okay,
Sean, it should be noted, Sean, that the application process is part of it is to filter folks who are serious, who really want to commit to the effort, because they have to go through a process, they have to apply, they get interviewed by us, they have to get recommendations from community leaders. So again, we want people who are serious, who are committed. All right. So those folks who were accepted did not come in. They really have hardship, and last minute things come up in their lives that kind of derail. And again, which is a regular occurrence in the targeted communities that we're going after. People who want to do the right thing, committed, but life take over in their own lives that derail the plans that they have. So we continue to work with them, recruit them, and we're gonna keep at this until we get people in those communities to have the knowledge to become a resource for the communities that for the most part don't have access to that knowledge.
Yeah, no, I think that's an excellent point, James. It really is unfortunate that people, have the drive and the ambition to take on this opportunity, and then things like childcare and transportation get in their way. And it's unfortunate for them, but it's also unfortunate for really the communities in Connecticut as a whole, because that they lose the opportunity to have these people come into the broker community and contribute in that way. So sorry to hear that, but I hope we continue to work on ways to help these folks get follow through in the future.
Yeah,
Thanks.
and we've really thought about, adding maybe a virtual class, but the training itself is so intense. The in-person experience is really important, especially for this group. A lot of the folks have not been in school 10, 20 years. So we're really starting fresh with this population. So having a fully virtual class may be more convenient, but I'm not sure how that would translate in terms of if folks getting through the class and passing. So stuff we have considered that as well. We do know it's a huge commitment coming in for a week, right? 3 days out of work at least. So we're still thinking about different ways, Sean. Thank you.
That's great. Are there any further questions, updates, or comments? Great. Hearing none. James, if you, unless there's anything further, we would entertain a motion to adjourn. Thank you for the great reports.
Thank you.
So moved, Paul Lombardo.
Thank you, Paul. And a second?
Second from Sean.
Thank you, Sean. Could we have a roll call, please, Margaret?
Thank you, Mr. Chair. Steve Hernandez,
Yes.
Grant Ritter,
Yes.
Paul Philpott, Paul Lombardo,
Yes.
Matthew Brookman, and Sean King.
Yes.
Thank you.
That's great. Again, thank you, everybody, and thanks for a great report and meeting. And with that, we are adjourned.
Thank you all.
Thanks, everybody.
Great day.
Have a great day.
You too.